all of you. This is Dr. Manpreet here from the Tertiary Care Hospital in Jalandhar. Today, I would like to address you all with the hypertension, which is like growing public problem these days. Uh, we all know that hypertension, I think people around us, we are very much aware of the problem. What is hypertension? It's all whenever we talk to other people, every second person or third person is hypertensive. So let's now discuss what hypertension is. Normally, we have our heart, which pumps the blood into the blood vessel, and it exerts the pressure on the blood vessels. And this is known as the blood pressure. And we have two kind of blood pressure. One is systolic blood pressure, and the second is the diastolic blood pressure. Systolic blood pressure is when the heart pumps the blood into the blood vessel, it exerts a pressure on the wall. That is the systolic blood pressure. And when the pressure in the vessels, when the heart rests in between the beats, that is the diastolic blood pressure. Normally, we expect our blood pressure to be around 120 by 80. It is okay if the blood pressure is 100 by 70, 110 by 70, that is okay. But if we get three readings half an hour apart or more than 140 by 90, we label the patient as having the hypertension. So these days, why we are worried about hypertension? That is the topic of discussion, because it's a silent killer. Slowly and slowly, it damages our blood vessels, not only the blood vessels of the heart, but also of the brain, also of the kidney, leading to the common problems like stroke, coronary artery diseases, renal failure, and it also damages the blood vessels of eyes. You can have retinopathy, which can result in blindness and other problems too. So if we think the hypertension is such a common problem and it leads to so many critical conditions, then can we prevent it? Yes, we can prevent it. We can definitely prevent it with the simple measures in our daily life. But before that, we should know what leads to hypertension. Number one risk is age. We all age. As we all age, our arteries get stiff. So as they get stiff, our blood pressure increases. And the second thing, family history. If we have anyone in our family, close relatives, suppose my brother, sister, your mother, father, grandmother, grandfather, if anyone has the blood pressure in the family, you are definitely at higher risk of having blood pressure. Then your lifestyle is the third important thing. Lifestyle, which includes your daily dietary habits. If you consume more of alcohol and smoke, and if you smoke quite often, that definitely puts you at higher risk for hypertension. And regarding the consumption of food, if you use more often processed food, carbonated beverages, they put you at higher risk of hypertension. But if you consume the food which is high in sodium, high in saturated fat, that puts you definitely at high risk for hypertension. Then the other things which increases the risk of hypertension is stress. These days, stress is quite commonly seen in the people. So if you have high stress, then obviously your sympathetic drive increases in your body, which puts you at higher risk for hypertension. Then the other things which put you at higher risk for hypertension is your certain drugs, other drugs like certain people, they are drug addicts, use of amphetamines, cocaine, they definitely put you at higher risk for hypertension. Now, how can we prevent hypertension? We all know that 17th May is celebrated as a World Hypertension Day to spread the awareness among the general population regarding hypertension. They should be knowing about what hypertension is, and if they have that problem, how they can prevent it, because prevention is definitely how they can cure it, and moreover, if they are not hypertensive or they're high risk for hypertension, like someone in the family is hypertensive, at that time how they can prevent the hypertension from happening. So 17th May is the World Hypertension Day. So it definitely is celebrated to spread the awareness among the general population. So coming to the main topic, which I was stressing on from the beginning, that is how we can prevent hypertension. Number one, see, age is a risk factor, but everyone will age. We can't do anything. Regarding family history, we can't do anything. So regarding our diet and lifestyle, definitely we can work a lot on it. Now use a processed food less, like homemade foods are better. carbonated beverages, don't avoid it. Use more of like lemon water, because lemon is rich in potassium. The potassium rich foods will be definitely helpful. Sodium will be definitely problematic, so use less sodium and use more of potassium. So that is important. Fruits and vegetables include in your diet. Green leafy vegetables you include in your diet. Brisk exercise, brisk walk. Exercise is very important. Like you can go for a walk. Aerobic exercises, adequate weight, and that will help in reduction of blood pressure. And together with that, if you are alcoholic or your habit of smoking, try to cut down on it, because alcohol and smoking, despite being causing hypertension, they are carcinogenic agents also. So, on the whole, you should avoid or try to cut down on alcohol and smoking. And if you need some medical help regarding that, you can seek for that. Now, the other important thing for prevention is stress management techniques. These days, we all are working. There is so much buzz going on in our life. It's very important to know the stress management techniques. You can engage yourself in yoga, in deep breathing exercises, or in whatever you feel you make you happy. Being happy in life is very important. You can manage your time accordingly, because management of time and giving yourself a time and being happy is more important. It will help in reduction of your stress. Do whatever you want to do. Make yourself happy. Then only you can lead in a happy life. Then the other thing which is important is, I have told you, exercise and the reduction of weight. Use the diet which has low cholesterol, low saturated fat. You should cut down on the diet which is high carbs, which is high fat, because ultimately that will lead to obesity and dyslipidemia and cholesterol deposition in the blood vessels, and ultimately leading to hypertension and the other atherosclerotic cardiovascular disease, which definitely we want to prevent in our life. Then the other things which I would like to say is the hypertension, as I've already told, it causes the great risk to our to the different organs of our body, be it your heart, your brain, your kidneys and other things. Suppose you have got and take the regular medications, go for the regular checkup, which includes your blood investigations, your urinary investigations, and the other things. And be adherent to your medications, take your medicines regularly. Thank you.